Hello, this video will be an update on what's been happening with my health and generally just what I've been doing. Um, yeah, several of you have asked just for an update about my life in Japan, so that's what this video will cover. As far as I know, there's still no sort of big cancers in my body at the moment. Recent blood tests are all fine. Next month I'll have a CT scan, so this will be 4 months since the last one. So before I was having scans every 3 months, now it's every 4 months. If this one's clear, then I'll be having scans every 6 months. And if possible, I will have a PET scan once a year. They're horrifically expensive if not not done with health insurance, but occasionally there are ways to get them on the insurance. So yeah, just the reason for that is PET scans are can be a more useful scan than a CT scan. And PET scan includes a CT scan as well. It's called a PET CT scan, and PET scans are also safer. With CT scans, or at least I have enhanced CT scans, which means you're given an injection of a contrast agent. And this contrast agent, there's a small risk it can do kidney damage. And although the risk is small, it's irreversible. When you have a PET CT scan, you don't have the contrast agent. And a contrast agent isn't used for the PET scan anyway. And the CT part of it, you just have without contrast agent. So, yeah, things have been really difficult for the last few weeks, which is why I haven't made a video. I didn't want to make a really grim one. But I'm in a lot of pain, kind of intermittent pain in the mornings generally. And it's making daily life really, really quite difficult. A couple of weeks ago, I went for an endoscopy, and it seems that the place where my intestines were reconnected last year, that's now 10 millimeters in diameter, which is kind of enough for safety. And yesterday I went to see the surgeon again. We kind of discussed the endoscopy and my abdominal pain, and he doesn't really think that doing the procedure again, the procedure is a balloon and angioplasty, I think, balloon angioplasty. So this is where the scar tissue is like broken up, I think, using a balloon that's filled up with high pressure water in your intestine. A tiny, tiny balloon. It kind of, would be like, yes, when it's completely full of high pressure water, it may be 20 millimeters across. So the surgeon was talking about doing the procedure again, but he's not really convinced it will help me. So he thinks the risk isn't outweighed by the benefit at the moment in my case. Now, if my situation gets worse, he'll have to do the procedure regardless of the risk. When I did it a few months ago, that was because my intestine had scarred up to like 3 or 4 millimeters diameter, which is fatal. So in that case, the benefit far from outweighed the risk. The risk of the procedure doing severe damage is low, but he described the damage as catastrophic. So the damage would be bowel perforation, so like actually getting a kind of hole in your intestine and needing surgery to deal with it, but then having potentially very low quality of life afterwards. So at the moment, he doesn't want to do the procedure again, and he's probably, well, presumably he's correct. But that leaves me with kind of abdominal pain for the first few hours of most mornings. It's not continuous pain, it's kind of intermittent pain throughout the mornings of every 20 or 30 minutes. I think it's the pain is kind of caused by an irritation of the intestines around the area where it's scarred up. But the surgeon was saying that it may just, or not just, but it may be kind of a post-surgical thing. So like as a result of the surgery and kind of forever, which would be really difficult to deal with. So at the moment what's happened is, so for the past couple of weeks I've been taking 2 medicines, and I've been given those 2 medicines for another 2 months. And the medicines do help. One is magnesium oxide, which sort of kind of encourages like the action of the intestines. And the other one is dimethicone, which has several functions, but one of them is like it stops your intestine getting irritated by like pressure differences in the intestine and stuff. Yeah, they don't really have side effects for me, but magnesium oxide is not, it's not a medicine I like, because it's just not very nice to have it. It kind of works by causing mild irritation in your intestine. So when you have an irritated intestine, it's not something you want. But yeah, it sort of does help a bit, but it's kind of it causes discomfort. So yeah, maybe I'm having slightly less pain, but there's kind of discomfort most mornings. So yeah, that's the kind of current situation. So regarding the cancer, I'll have a CT scan next month, blood test tomorrow. So I have blood tests every month, and measuring, well, it's a full count blood test, which means white blood cells and liver function and inflammation, or just kind of a general blood test, and then also 2 tumour markers that sort of look at cancer activity, and so far those have been fine. Yeah, so as I say, it's been a few really difficult weeks, really hard to kind of function and get anything done. The only kind of positive thing is I have been helping a couple of people who are well, yeah, three people with cancer. So yeah, 2 of them outside Japan who want to come in for treatment. So I've been getting them information and discussing with them the treatments I've had and what sort of stuff is available here. Japanese cancer treatment is very advanced and very reliable, in that it's kind of advanced cutting edge treatments are used almost not exactly routinely here, but are kind of quite accessible here, and are done in a very competent way. different from some other countries that will remain nameless. So yeah, it's a great place to come if someone has late stage cancer, or is running out of options. Then Japan is a great place for treatment. At the moment, it's kind of hard to get into Japan because medical visas aren't being issued at the moment, and officially you're meant to have a medical visa. You can I think you can like sneak into Japan for other reasons and then coincidentally get medical treatment here. So that's been good, and doing some sort of video calls about that. And yeah, I've been reading a very good book called Write Useful Books. This is because I'm currently working on a guide to cancer care in Japan for either non-Japanese who are living here and need to know about cancer treatment, or for people wanting to come into Japan. So that's, and actually generally I don't read for fun usually because I'm so busy reading for study. But I recently saw in a used bookshop copy of Generation X by Douglas Coupland, and I thought I would just read it to try and get myself out of the slump that I've been in over the past few weeks and take my mind off the pain. So that's been fun. Not a fantastic book. He's not a great writer, but kind of culturally interesting. So we had several kind of questions just about life in Japan and how I'm doing. And you may have seen in the news that there was a very big earthquake recently. Fortunately, it didn't seem to do so much damage. And out here on the edge of Tokyo, we're completely unaffected by it, other than being quite terrified because it was long and powerful. It was, I think, 11:30 at night a few days ago, and it was seriously strong and went on for a long time. And I think it was out to sea off the coast of Fukushima, which obviously had the triple disaster a few years ago of earthquake, tsunami, and nuclear, or possibly nuclear meltdown, I guess. But nuclear or multiple nuclear disasters. But that was fine. And bizarrely, yesterday there were kind of warnings about, I guess, what you'd call a brownout, so kind of power shortages in Tokyo. I don't know how much truth there is to any of the claims, but allegedly there are kind of issues with people using too much electricity in Japan at the moment because since the Fukushima disaster, at the time all the nuclear power stations were shut down, and then they've kind of gradually come back on, being brought back online. Japan at the moment, I think most of the power is oil, imported oil and imported gas and imported coal. Japan has loads of hydroelectric power available. I've seen lots of hydroelectric dams here, many of which I think are not in use generating power. I don't know why. They're just sort of built in the bubble time, in the sort of late 1980s. That's obviously a concern. We're obviously watching the Ukraine situation very closely, as is everyone else. Russia is one of our neighbours, as is China. So yeah, we're watching that closely. Yeah, so other than that, really, I guess I'm doing okay. At least at the moment, it seems that my body is not being overrun with cancer, which is just amazing to think about that. I mean, I'm coming up to the 6-year point, and when I was diagnosed in the summer of 2016, 7 to 9 months was the realistic life expectancy, and that's with treatment. That's not kind of when the doctor says, if we don't do anything, you may last a year. It's like that was with treatment, that was with surgery and chemotherapy. 7 to 9 months was a realistic life expectancy. So it's incredible to be here and be at least superficially cancer free. Now for I think 2 years, I haven't had any visible tumours. Blood test results have been good. Yeah, so that's kind of amazing. Possibly in a few months' time, I'll be able to have this new microRNA test. So this is a test jointly made by Toshiba and Toray, which is another Japanese company, and it's looking at microRNA, and it's designed as a screening test. So it's one of these slightly dodgy sounding tests where they like take a drop of blood and are able to get useful information from that. But this one's been through a lot of testing over quite a few years now, actually, and it's been tested on tumor tissue from humans. So this is like when they take samples of tumor tissue in surgery, and then they kind of test it to see if it was cancer or not. And then this is archived, so this microRNA test is using that tissue. So they have thousands of samples of tissue, of which many are cancer and many are not, and they can kind of compare and see how well their test does. Although it's a screening test, it's meant to be at least 100 times more accurate than the normal like monthly blood test I have, tumor marker blood test, which isn't like saying a lot because tumor markers are not accurate at all. It sort of seems to depend on patients, and yeah. So still, this is yet another test that I would like if I can get hold of it. It's being used in Japan now for a couple of cancers, but hasn't been approved yet for colorectal cancer. But when it is approved, I shall get that and yeah, see what it says, because it would be nice to have more reassurance. So when you have cancer, you have this thing called scanxiety, which is kind of the anxiety you get before the scans, or even kind of just with blood tests. Although we sort of know blood tests aren't very accurate for cancer, so the scans are what cause us more concern. So it would be nice to get some more reassurance that my body is not kind of overflowing with cancer. But at the moment, everything seems fine except for my crippling abdominal pains. Anyway, thank you so much for watching. Yep, I will do another video in a couple of weeks, maybe with some good news. We shall see. But until then, take care and thanks for your interest.